Hey, Dr. Sampson Davis, back with my health and survival plan. So often I'm asked, what is the craziest thing I've seen in the emergency department? And I've been practicing for some years now, so I've seen a plethora of everything that you can imagine. But Tim asked me the other day, one of the guys that work in the cafeteria at my hospital, he asked me, he said, Dr. Davis, man, I love ER, and what's the craziest thing you've seen? And so I went back upstairs, and just so happened, the most insane thing unfolded. I'm taking care of a patient at a new hospital I just started working. And it's unfortunately an older gentleman. He was in respiratory arrest. He was breathing, working real hard to breathe. I had to stabilize his breathing. And in another room, about maybe few yards down, another patient I care is screaming that EMS, the ambulance crew, brought in. And this patient, she was 40 years old. She was screaming. She was in a lot of pain. And mind you, this was an overnight shift. And if you know me, I love, in the worst way, working night shifts. And so it was 3 a.m. and this patient was screaming. And so the nurse was in the room triaging the patient, getting the patient vital signs so I can go in and take care of the patient. So the nurse said, Dr. Davis, come in right away. So I go in and the patient was experiencing vaginal bleeding. So I started to examine her. I asked her to bring her heels together and let her legs fall to the side so I could see what was ongoing. And there was this blood coming out. She said she started bleeding about 2 hours prior, and I was moving the blood out of the way and clots and everything. And I don't mean to gross you out, but I just want you to sort of get an appreciation of what was going on here. And so I'm moving the clots away, the blood away, and all of a sudden I go pop. I'm like, whoa, what is this? This does not look like a blood clot. And I touched the thing, it was kind of, whatever popped out was in a sack. And I'm like, are you pregnant? And she said, no. I was like, well, this baby right here tends to disagree with you. So she gave birth at 3 o'clock in the morning to a 6-pound baby boy. And it was crazy because, again, she didn't know she was pregnant, nor did I, because my first introduction to her was she was screaming in agony and a lot of pain, and she was bleeding very heavily. So I had no expectations or clue that she was pregnant. I asked her initially, she said no. And so that was a pretty crazy, intense story. I was not expecting that, nor was she. And now she's a mother for the second time to a brand new, bouncing, healthy baby boy. ER Chronicles, you just can't make this stuff up.